pandemic may be in our rearview mirror, but the COVID virus has not gone away. In fact, we are now seeing a summer surge with infections from a newer strain on the rise. Even our president has COVID. So joining us now live is infectious disease specialist Dr. Peter Chin Hong, talking about the return of COVID. Doctor, as always, it is great to see you.
Thanks so much for having me on, Mel.
So the CDC has a map showing the U.S. wastewater viral activity level, which is high for COVID-19 right now. California is now one of 7 states where wastewater levels of the virus have soared to the very high mark. There's that map right there. Yikes. Okay, so why do you think we are seeing our cases soar in the Golden State right now?
Well, I think there are a few reasons, Melanie. The first is that we have a new family of variants that are more transmissible than the previous one in the winter. The second is, of course, people are traveling more. Revenge travel is still a thing, graduations. But most importantly, in California and some of those states in the South, Texas, Florida, lots of heat, especially in California, driving people indoors. It's kind of like the new winter, and that was a big risk factor for spreading it. After the wastewater showed there was a lot in California to begin with. And you add 6 months to the last time a lot of people got infected. The frontline antibodies have waned off, so it makes it easier to get.
Yikes, so heat just really impacting us in more ways than one. Currently, what is the dominant strain that we need to know about? What do we know what it's doing so far?
Yeah, so people might have heard about this family called FLIRT. They are a group of 3. They have names like KP1, 2, and 3, and there's another one called LB1. They're essentially a little bit more transmissible. They don't cause more serious disease. And they're a little bit more slippery, but our memory immune cells still come out after time. But the virus can enter in, and that's why a lot of people are getting infected, but not a lot of people are going to the hospital.
Doctor, Joe Biden was recently diagnosed with COVID, our president. And for someone who is 81 years old and under a lot of stress of running the country, this could be dangerous for people like him, right?
Yes, the risk of hospitalization, doing poorly, chronic complications really increase, not just after age 65, but really after age 80. But he's up to date on vaccines. He did get Paxlovid, so we're crossing our fingers. I think he was in Nevada. That's really one of the very high transmission states like California. So it's no surprise that he would get it at some point. But this is the 3rd time he's gotten it. So we have to really watch out and tread carefully around him.
So what would you tell our viewers who are watching right now? Some of us might have gotten complacent. Really, we're trying to do our summer travel. We don't really want to think about COVID. What would you say to people in terms of getting boosted for the summertime?
Well, I would say the number one thing is, based on my experience and what I know so far with this current increase in cases, your symptoms that you had before is not really an indication of what symptoms you might have. Some people are getting it really severely in terms of wiping them out. So it's not something you'd want to wish on anyone, even if you weathered it well before. I would say, especially amongst those who are immune compromised or older than 65, we have to be very careful. So if you're in a house with somebody like that or you're like that, you have something that seems like allergies, please get tested. Please think about getting Paxlovid, particularly if that person who's vulnerable didn't get a vaccine in the last year, and think about getting the vaccine, even if there's one coming out in the fall.
Yeah, we had a coworker who was recently diagnosed with COVID. He said he could barely find a test these days because these cases are really ramping up. So, doctor, thank you so much for joining us this morning. Again, giving us a lot to think about COVID and the summertime. Thank you so much. We will see you again.
Thanks so much, Mel. Bye.